Hi, my name is Sieber. This is my Barium Enema video. Before you start your procedure, you want to make sure you have the proper supplies. This is an IV stand that's going to hold our bag. This is a gown for the patient. They're going to change into it. A sheet. We have jelly to apply to the tip. Gloves, which I'm wearing already. This is the BE kit. It has the tubing, the tip, as well as the bag. We have a bowl here. This is the sponge that we're going to use for various positioning. IR stand. I already have chucks down. You want to keep things clean and sanitary. And a pillow for the patient. So now we will go and get our patient. Hi, Clarissa.
Hi.
Hi, my name is Will. I am a tech here, and I'm going to be assisting in your procedure today. So we're going to be doing a BE, Barium Enema. Have you had one of these before?
I have not.
Okay, so I'm going to explain a little bit what you need to expect. We're basically going to be inserting some tubing into your rectum, which is going to fill your colon with barium. It'll allow the radiologist to do the inside of your colon to determine if there's any issues.
Okay.
So what brings you in here?
I've just been having a lot of pain in my stomach recently. It's been going on for about 2 weeks now.
Okay. Have you had any surgeries in that area that we need to know about?
I have not.
Okay. And have you been following the diet as far as, like, have you been fasting?
Yeah.
When's the last time you had food?
It was more than 24 hours ago.
Okay, good. And have you been doing the liquid diet
Mm-hmm.
as told? Okay. And I have to ask before, because we are working with X-rays, is there any chance of pregnancy?
No.
Okay, very good. So basically, that's what we're going to be doing. So the radiologist is going to be performing most of this, and then once he leaves, I'm going to be doing a handful of other images with you, okay? It shouldn't take too long. Do you have any questions for me?
No.
Okay, so we're going to get started. So before we start, I'm going to have you change into this gown, okay? Remove everything from everything from top and bottom. You can't have any clothing on for this procedure, okay?
Okay.
So come out whenever you're ready in the gown, okay?
Sounds good. Okay, I got it.
Awesome. Okay, so I'm going to have you lie down on your back, okay?
Okay, sounds good.
So this first image we're doing is called a scout, and this is taken before any barium is inserted. So we are going to go to the level of iliac crest. I'm going to feel here, okay?
Okay.
Make sure I have you in the right spot. Mid-sagittal plane. Okay, and we have 14 by 17 collimation. So I'm going to give you some breathing instructions, okay? All right, so we go on the back. Okay, take a deep breath in, blow it all the way out, and hold it. Get exposure. Okay, you can breathe. Our technique for that is 16 at 80, and we just want to see the entire colon without barium in it. Okay, so now what we're going to do is I'm going to have you roll over onto your stomach, okay? And go ahead and raise your right leg. You're going to be in the Sims position here. This is where we are going to insert the tubing. So we're going to apply some jelly to the tip of the tube. And we're going to apply it, put it in the rectum, and it's going to be 1.5 inches, inserted 1.5 inches anterior and 1.5 inches superior. So in and up. And then you can go ahead and put your leg down, okay? So now that the patient is on her stomach, what we're going to do is we're going to, again, be at the level of iliac crest. So we're already there. And we're going to be taking another image, mid-sagittal plane. Okay, so we're going to use a marker here. Should have marked the last one too. So I'm just going to mark the patient's left side here. And you can find light anywhere, so there's some. Actually, here's your left. Okay. Okay, go ahead. Take a deep breath in. Blow it all the way out. Hold it. Exposure. You can breathe. Our technique on that one is 32 at 80. And what we want to see on this one is the transverse colon filled with barium. Okay? So now what we're going to do is we're going to move to an axial. Let me move the tube to 30 to 40, about 30 to 45 or 30 to 40. I'm just going to go to 35 here. And on this one, you want to find the as is and as is. So I'm going to feel your hip here, okay? So find the patient's as is. You want to be at the level of as is. And you're going caudal here. Okay? And we're on the mid-sagittal plane again. Okay? We'll mark the patient's left side. Okay, and then we will take another image here. Take a deep breath in, blow it all the way out, hold it, exposure. You can breathe. Technique here is 50 out of 100. And so now that we did that one, we're going to put our tube head back to 0. We want to see the sigmoid colon on that one. Okay. So now I will grab my wedge, and I'm going to go ahead and place this underneath you, okay? Now just go ahead and lie on that. Perfect. Okay, since the patient's right side is down, we're going to mark the right. I'm just going to place it down here. And so you want to be, for this one, you want to be again at the iliac crest. So we're going to go back up. And you want to be 1 to 2 inches on the upper side here. So find like the raised side, and you want to go 1 to 2 inches above like the spine here. So we're about right there actually. Again, we're going to mark the side down. Okay? So I'm going to give you some breathing instructions, okay? Take a deep breath in, pull it all the way out, hold it, exposure. You can breathe. Technique is 50 out of 100. And you want to see since the right side's down, you want to see the right hepatic flexure. So now what I'm going to do is I'm going to remove this, and I'm going to have you rotate onto your right side facing me, okay?
Oops.
Now our fluoro machine, normally you would rotate the tube around like this, and we'd be coming in for decubitus, but since our machine isn't that cool, I'm just going to vocalize what I'm doing. What I would do is I would put my IR, I'm going to slide this behind your back, okay? And then I would put my IR there, this tube would come around, and we would be on the mid-sagittal plane here. So I'll just say what I would do. I would mark, since we're in decubitus, we're going to mark the side up. So I would mark her left side, because that's what's up. And then we'd be on the mid-sagittal plane. And that's what we do. So I would say, take a deep breath in, blow it all the way out, hold it, exposure. Okay. And now I will get this out. Okay, now that we've done that, you can roll over onto your back. Okay, and now I'm going to place this underneath here. This is going to be the LPO position. So since her left side is down, I would mark her left side. And again, same thing. Let's see here. Let me think for a second. It's confusing me. Okay. So we're in LPO. So the left side is down. You mark the left. And you want to be at the iliac crest. And you want to be about, again, 1 to 2 inches. Let me think here. 1 to 2 inches from on the raised side. Okay, so we're about there. So you just find like the spine, or find the midline, and go up 1 to 2 inches from there. So we're pretty much there. Again, we have our marker. Again, I'm going to have you take a deep breath in, blow it all the way out, hold it, exposure, you can breathe. Since the left side is down, we want to see the left hepatic flexure this time. Put our marker back. Now what I'm going to do is I'm going to remove this, and I'm going to have you go up onto your left side, facing out that way. This time we're not doing decubitus, we're just going to do left lateral. So we're going to be on the mid-coronal plane, okay? And on this one you want to be at the as-is again. So find the as-is, we'll go there. And about mid-coronal plane, so she's about here. So we'll go down a little bit more. Okay, her left side is down. So we'll mark the left side. Okay, go ahead, take a deep breath in, blow it out, hold it, exposure. Okay, technique 50 at 100. And at this point, since the patient is in this position, we're going to take the, I would say, okay, so now I'm going to be removing the tip, okay? Before we do that, we would take it off of the stand, the bag, and we put it down here, let gravity flush the tube as much as possible. Then I'd say, okay, we're going to be removing the tip, and you would tell the patient, as I pull the tip out, you're going to breathe out, okay? Remove the tip, okay, and then I'm going to move this. Okay, Clarissa, at this time what I need is, you can get up and go to the bathroom, and I'm going to have you just try to remove or evacuate your bowels the best you can. Okay, and then once you've done that, you can come back, okay? Okay. So I'd send her to the bathroom. She would come back.
Okay, I'm back.
Okay, go ahead and lie on your back again, as before. So this is kind of similar to our initial image. Now that the barium has been evacuated, we're just going to do kind of like another scout image, I guess. It's not really a scout, but it's just a way to look and see, make sure you have all the barium out of it. So again, at iliac crest.
Are you still in here?
Iliac.
I think you need to give that patient extra barium.
Well, that's rude.
All right, good night, guys.
Good night.
Good night, Mel.
Okay, so we're at the level of iliac crest, mid-sagittal plane. We're going to use a left marker, patient's left. And so what we're going to do now is we're just going to take one more image. This is going to be the final image. Okay, take a deep breath in, blow it all the way out, hold it, exposure. We're at 50 at 100, I think, around there. I think it might be a little different on that last one. And then the point of, all you want to see on this one is the entire colon, and the barium has been removed from the colon. And you want to see it in its entirety. Okay, Clarissa, at this time we are done with our procedure and our imaging, okay? So go ahead and sit up very slowly, take your time. don't want you to be lightheaded. So you can stay there for a second, okay? So basically when you go home, I want you to be drinking a lot of fluids to flush that barium out. It's kind of chalky and, you know, it's going to come out white, so don't be alarmed by that. Additionally, if you're constipated for a number of days, I would contact your doctor and they might need to give you some laxatives because the barium is kind of chalky. We're going to get those images sent over, okay, to the radiologist, and I'm sure your PCP will get them and they'll be in touch with you. Do you have any questions for me? Okay, so you can go in the bathroom and you can change out of your gown. And when you're done, you can come out. Okay, thank you for coming in. Really appreciate it. And if you don't have any further questions, you can go.
Awesome, thank you so much.
Okay, thanks a lot. Have a good day.
Bye-bye.
Bye.